One of the services I provide here at Ohana is checking primitive reflexes. Hi, I'm Jolene from Ohana and I've been working with kids for 16 years, more specifically in primitive reflexes for the last 10 years. A primitive reflex is a reflex that we are born with and they should become integrated and change into a postural reflex. If this doesn't happen, we can have some issues. So, a primitive reflex are the ones we are born with, and as we grow and our nervous system matures, they become postural reflexes, motor patterns, and then higher functioning learning. So the research that's coming out is showing that it's really important that these do integrate at appropriate times. Today I'm just going to talk about 3 of them. The first we're going to talk about is the morrow or startle reflex. This is the reflex where when you turn your baby to put them down in bed or extend their head, they flail their arms out and then come back down. If they don't come back out, they're a bit stuck in their startle reflex and they take a bit of soothing to calm back down. This normally integrates around 4 months of age, and that's why we like to swaddle our babies in that 0 to 4 month age group. In an older child, if this hasn't integrated, what we see is a hypersensitive nervous system. So we have reactions to sudden light and sound changes, supersensitive sensory processing issues, and social emotional immaturity signs and symptoms. The second reflex I'm going to talk today is called the Palma Reflex, and that's the one where babies grab onto anything that's popped in their hand, especially mum's hair, and it's a whole hand grasp. And this should usually integrate or change at 5 to 6 months of age. In an older child, if this hasn't integrated, we can't use our pincer grip properly, manual dexterity of the hand, and we have very messy handwriting because we hold the pencil like this. So the lovely Edie here is going to be our model to show us how we check this in an older child. So we're going to pop arms and hands just up like this, and then we're going to use a very simple paintbrush just to stroke through the hand. And Edie is perfect at showing a normal response. So if she had a retained reflex, she would suddenly grab this or do a slow curl of her hand or slow curl of the elbow. Thank you, Edie, good job. The third reflex I was going to talk to you today about is called the asymmetrical tonic neck reflex, or the ATNR. This is a head and arm connection reflex which is utilised for the birthing process. It usually integrates around 6 months of age or when babies start learning to crawl or using their cross crawl pattern. And this reflex is the one where when we turn our head, the hand on the same side extends, the hand on the other side flexes. In an older child or an adult, this is a problem because we don't have hand-eye coordination very well. We can struggle copying things off a board and have poor tracking with our eyes, so poor reading skills. It's also the one in traffic when someone looks at their blind spot that they've already turned instead of waiting to see if a car's coming. So there are several ways to check for this, and we're going to practice one with Edie here again today. You're going to put your arms straight up again. Perfect. And then I want you to turn your head that way. Good. And then turn your head the other way. Good. And that way. And the other way. And again. And that way. Perfect. So if she had a retained reflex, her arms would be swaying with her head movement. But once again, they're not, because yours are all really good, aren't they? Yeah. So that's just 3 reflexes. There's many, many more. If you'd like more information, you can find some on our website, or you can call to have a full assessment.